Now, this may be surprising, but many communities do not have heart doctors, especially in rural communities here in Mississippi. And a recent study came out that is very surprising. Three, two, one. Okay. Okay, three, two, one. Now, this may be surprising, but a lot of communities, especially in rural areas, do not have heart doctors. And I'll do one more time, Brad. I can't even think of it. I'm trying to ad lib. Three, two, one. Many communities, especially in rural communities in Mississippi, they don't have heart doctors. And a recent study came out that is very surprising, and it has a far-reaching negative impact. I'm joined by Dr. Felucio to talk a little about the study and the need to have more heart doctors in rural communities and across the state. How are you?
Hello, thank you for having me.
Okay, talk about this recent study.
Yeah, so the Association of Black Cardiology looked at a recent survey that evaluated basically the limited number or lack thereof of heart and vascular specialists across rural areas across the country, and particularly looking at rural communities here in the South, because we saw that about 50% of heart disease, which is the number one killer, does occur actually in areas where they lack heart and vascular specialists. If you look at the southern areas, particularly in a state like Mississippi, 80% of the counties in Mississippi do not have a heart or vascular specialist. I repeat, 80%. And so, what are commonalities in that? You see that they are rural, they lack access to care, and they drive about 60 minutes at least one way to see a heart or vascular specialist. And this is shocking, but majority of the patients look like you and I. They're minorities. They're Black.
Wow. So, why do you think that's the case? Why do people tend to suffer due to their zip code?
Yeah, well, we already know that the social determinants of health or social drivers of health is a big factor. And if you look at a state like Mississippi, which has, 40% African American population, which is one of the largest in the country, you look at some of those risk factors: housing, transportation, geography, in terms of where schools are located, but also economic resources that are poured into the healthcare system. And then you take a totality of that and you add the access of healthcare or lack of access to quality healthcare, the hospitals that are spiraling down and shutting down. If you look at kind of the gumbo of it all, right, you see that majority of these things are occurring in regions such as Mississippi, Louisiana, North Carolina, which also have high predominantly African American states, but nothing that tells closely to what we see here in Mississippi, where counties like, Claiborne County, you look at Jefferson County, you look at Coahoma County, you look at Tunica, and you look at places like Holmes County, predominantly African American regions that do not have a cardiologist. And so, what are the consequences of that? Heart attack rates, stroke rates, amputation rates, death rates are highest in these regions. The life expectancy of Black patients in these regions are 10 to 12 years below the national average. And access to not only preventative care, but the gaps in quality care upstream throughout the continuum of someone's heart and vascular workup takes a longer time. And so they present at advanced stages and therefore suffer the ultimate consequences, which is a death.
Wow. And when you hear those staggering statistics, what goes through your mind?
It's the reason why I moved here 10 years ago. I'm an adopted Delta boy, as I said. I grew up in New Jersey, New York, and I came here 10 years ago knowing these statistics, but knowing that concordance matters. Development of trust and community engagement is very important, but also informing our communities to transform. You got to teach them basically what their issues are. You got to inform them as to what their risks are. And they have to understand that things like their cholesterol levels, like their blood pressure levels, the cessation of nicotine use, sugar levels, right? Knowing that, hey, that sugar and that pressure have to be controlled to avoid you losing your circulation in your legs or to your heart. So therefore, avoiding that heart attack or avoiding that amputation or avoiding that stroke is actually more upstream, cost saving, life saving, limb saving, but also ultimately you do have a generational save in terms of ending a generational scar that I just outlined earlier.
What programs and solutions need to be put in place to help combat this problem?
Yeah, whenever I think of a problem, I think of clinical, economical, human, and then policy. I think from a local grounds level, I think having programs like we had the Delta Health Summit early in September, where we spoke to all stakeholders, including the Department of Health, that was well represented about this issue of cardiology deserts, and how we can partner with each other, not only to help educate our local champions and our local key gatekeepers, which are your primary care docs, as to what the risk factors of cardiovascular disease and why people are dying of heart and vascular disease in the state at a rate that is 10x above the national average, or why people are losing limbs at 200x above the national average in the
Wow.
Delta. Those are things that we need to educate the local communities. And then two, it's meeting patients where they really are, right? You hear that and it sounds cliche, but it's life in terms of educational awareness and community engagement occurs after 5 o'clock. It's meeting these patients exactly where you need to meet them. And also having the real discussions in their literacy level as to what those are and what the consequences are if they do not seek care early on. And the third piece is policy. What are policies to not only help recruit, but also to help train and retain physicians? There's a huge workforce shortage. So not everyone can afford at times living in in, like I said, in Holmes County or in Tunica County or in Claiborne to go to Jackson or Madison or Oxford to seek care in a tertiary care center. People have to really do their best in their rural and local areas to seek out care. And so economically, what is the cost not only to the patient, but to the families? And that's something that has to be worked on, not only by local, but also by federal agencies to see how we can have a better recruitment program of physicians to these shortage regions like the Mississippi Delta and Mississippi across as a state.
And here's the thing, we know that there are a lot of hospitals that are closing in rural areas. There are not a lot of clinics that people can go to. So, what about telehealth, expanding broadband? Do you think that would help?
Yeah, so telehealth is also something that has to stay in place. We learned through COVID that that was very vital in terms of providing access. And, there are policies that were in place right now to end actual reimbursement for that. And that's something that the Association of Black Cardiology has been on the forefront. And we're glad to say that that's going to be retained in terms of providing access to not only physicians locally, but it's also a way for communication. As a specialist, I can communicate with a primary care doc that's hours away as to how to manage a patient. And that seems to be the key factor, not only in rural areas, but even internationally as we try and communicate with our partners through what works in international regions as to some of the successes they've had that we can actually emulate here. Telehealth is something that we've seen to be very valuable. And also we've seen that making sure that we continue to empower our patients, knowing your risk, I think is the most important things, knowing what your blood pressure is, knowing that your age is a risk factor, knowing that a sedentary lifestyle is not good, knowing that, hey, listen, I know what my family history of cardiovascular disease are. Those are kind of the important factors that one has to have, and then knowing how to access care and where to go for that care. Those are also important steps.
A lot of great information. Anything else that I did not ask that you want to say to those who are watching, especially those living in rural areas?
No, it's we're hope. There's hope. I think where people see despair, I see hope, and I think the hope is number one, making sure we have an awareness campaign like this. So we want to thank you for the privilege of invitation to be able to share what we found. There are organizations, abcardio.org. I always say people, it's a great website. We're a great organization that's dedicated to bridging the gaps and disparities, particularly in people of color. That it was established in 1970s, early 1970s, and we have thrived. And so you can also reach out to me. It's PAD Advocate is my handle, social media handle. but also going to American Heart Association and other places like American College of Cardiology, where we have resources not only for the patients but for providers who are taking care of these people in these cardiology deserts. It's sometimes people feel that they're alone, but when they hear stories of how other colleagues are managing their patient population and their patient base and community base, sometimes you get inspired. And that's how we transform habits. That's how we transform that ask. And that's how we take the fight not only to our local congressmen and women, but also we take it up to Washington, D.C. on the national front to advocate for national change.
Well said. Well said. Thank you for joining me.
Thank you.